Hello everyone, let me start with a situation. Imagine a 58-year-old man sitting at breakfast. He suddenly drops the spoon from his right hand. His speech becomes slurred. The right side of his face begins to droop. His family thinks he is just tired or dizzy, so they wait. 1 hour passes to then 2 hours. By the time he reaches the hospital, a large part of his brain has already died. This condition is called a stroke. Every minute during a stroke, nearly 1.9 million neurons die. That means the difference between walking normally and permanent paralysis may be just a few minutes. So, today we are going to answer three key questions. What exactly happens during a stroke? Why does it occur? And most importantly, how can early treatment save the brain? Let us begin with the basic concept. The brain is one of the most energy dependent organs in the human body. Although it represents only about 2% of the body weight, it consumes almost 20% of the body's oxygen and glucose supply. Now imagine what happens if the blood supply to the part of the brain suddenly stops. That region of the brain immediately loses oxygen and glucose. Within minutes, the neurons begin to fail. If the blood flow is not restored, those neurons die permanently. This process is what we call a stroke. Stroke is not a rare condition. According to the World Health Organization, it is one of the leading cause of death and long-term disability worldwide. Millions of people every year either die from stroke or live with the permanent disabilities such as paralysis, speech impairment, or memory problems. But here is an important point. Not all strokes occur in the same way. Stroke is far more common than many people realize. According to the Centers for Disease Control and Prevention, about 795,000 people experience a stroke every year in the United States. Out of these, roughly 610,000 are first-time strokes, while 185,000 occur in people who already had a stroke before. To understand how frequent this is, think about everyday life. One stroke happens every 40 seconds in the United States. That means during a typical 10-minute YouTube video, about 15 people will experience a stroke somewhere in the country. For example, imagine a busy emergency department in a large hospital. During a single shift, doctors may treat several patients who suddenly develop weakness on one side of the body or difficulty speaking. Many of those cases turn out to be strokes. Stroke is not only common, it is also a major cause of death. In the United States, about 162,000 people die from stroke each year. This makes stroke the fourth leading cause of death in the country. Another way to understand this number is to think about time. One person dies from stroke about every 3 minutes. Consider a real life scenario. A person may suddenly develop slurred speech at home, ignore the symptoms, and delay going to the hospital. When treatment is delayed, the damage to the brain becomes severe, and in some cases, the patient does not survive. This is why rapid recognition and early treatment are critical. In the United States, about 7.8 million adults have had a stroke at some point in their lives. That is roughly 3% of adult population. This means stroke is not just an emergency event, it often becomes a long-term health condition. Many families have a relative who experienced a stroke years ago and still lives with weakness on one side of the body or difficulty speaking. These long-term effects change daily life not only for the patients but also for the caregivers and family members. When doctors talk about stroke, they usually divide it into two major categories. The first and most common type is ischemic stroke. This occurs when a blood vessel supplying the brain becomes blocked. The blockage may develop from a clot forming inside the artery, or the clot may travel from another part of the body. For example, patients with atrial fibrillation often develop clots inside the heart. That clot can travel through the bloodstream. It may suddenly block a major artery in the brain. When that happens, the brain tissue supplied by that artery begins to die. About 80 to 85% of strokes occur in this way. Now let us look at the second type. The second major category is hemorrhagic stroke. In this case, the blood vessel ruptures instead of becoming blocked. Blood leaks directly into the brain tissue. This compresses surrounding neurons and increases intracranial pressure. The most common cause of this condition is long-standing hypertension. High blood pressure weakens the walls of the small arteries over time. Eventually, one of these vessels ruptures and bleeding begins. There is also another condition called transient ischemic attack, often called a TIA. In this situation, blood flow to the brain stops briefly. Symptoms may last only a few minutes, then they completely disappear. But here is the important point. A TIA is often a warning sign of an upcoming stroke. Now we reach an important question. What causes stroke in the first place? Several risk factors increases the likelihood of stroke. The most important one is high blood pressure. Long-standing hypertension damages the inner lining of the blood vessels. It also accelerates the development of atherosclerosis. Another major contributor is diabetes mellitus. High blood glucose levels damage the vascular endothelium and promote plaque formation. High cholesterol adds another layer of risk by depositing lipid plaques inside arteries supplying the brain. Smoking further worsens the situation. It increases platelet aggregation and causes chronic inflammation of blood vessels. Obesity and second sedentary lifestyle combine many of these factors together. Let us consider a real life example. A 60-year-old patient with hypertension, diabetes, and long term smoking history develops progressive narrowing of the carotid arteries. Eventually, a clot forms in the artery. That clot travels to the brain and blocks a vessel. Within minutes, the patient develops weakness of one side of the body. This is the typical pathway leading to ischemic stroke. Now, let us go deeper. What actually happens inside the neurons when stroke occurs? When blood flow stops, brain cells immediately lose oxygen and glucose. Without these two elements, the brain cannot produce ATP. Once ATP levels fall, the sodium potassium pump stops working. Sodium accumulates inside neurons. Water follows sodium. The cell begins to swell. Calcium then floods into the cell. This triggers the release of excitatory neurotransmitters such as glutamate. This destructive process is known as excitotoxicity. At the center of the damaged region is the infarct core, where cells die rapidly. Surrounding that area is the ischemic penumbra. Cells in the penumbra are injured but still potentially recoverable. This is exactly why rapid treatment is critical. Now consider a practical question. How do you recognize stroke in a patient? Stroke symptoms usually appear suddenly. The most common feature is weakness on one side of the body. The patient may suddenly lose the ability to lift one arm or leg. Speech may become slurred or completely impaired. In some cases, the patient cannot understand language. Visual disturbances may occur as well. Some patients lose half of their visual field. Others develop severe loss of balance and coordination, especially when the cerebellum is involved. Another classic sign is facial drooping. Doctors often teach the fast route to recognize stroke quickly. F for face drooping, A for arm weakness, S for speech difficulty, T is time to seek medical help immediately. Once the patient reaches the hospital, doctors must act very quickly. The first imaging test usually performed is a CT scan. CT scanning rapidly identifies whether bleeding is present in the brain. This distinction is essential because treatment for ischemic stroke and hemorrhagic stroke is completely different. Another powerful imaging method is magnetic resonance imaging. MRI, particularly diffusion weighted imaging, can detect ischemic injury within minutes of onset. Doctors also perform blood tests and cardiac evaluation to identify underlying causes such as atrial fibrillation or clotting disorders. Now comes the most critical question. How do doctors treat stroke? Treatment depends on the type of stroke. For ischemic stroke, the goal is simple. Restore blood flow to the brain as quickly as possible. One major treatment is intravenous thrombolysis using alteplase. This drug dissolves the clot, blocking the artery. However, there is a strict time window. It must be given within 4.5 hours of symptoms onset. Another modern therapy is mechanical thrombectomy, where specialists physically remove the clot using catheter-based devices. For hemorrhagic stroke, treatment focuses on controlling bleeding, reducing intracranial pressure, and sometimes surgical removal of the hematoma. Even when patients survive stroke, recovery may take time. Some patients develop permanent paralysis on one side of the body. Others experience speech impairment or difficulty swallowing. Rehabilitation becomes essential for recovery. Physical therapy improves strength and mobility. Speech therapy helps patient regain communication skills. Occupational therapy teaches patient how to perform daily activities independently. Many patients achieve significant improvement through structured rehabilitation programs. Now the final question. Can stroke be prevented? The answer is yes, in many cases. Strict control of blood pressure alone can reduce stroke risk by nearly 40%. Regular exercise, healthy diet, and smoking cessation significantly reduce cardiovascular risk. Patients with atrial fibrillation often receive anticoagulation medication to prevent clot formation. Public awareness and rapid access to medical care remain critical in reducing stroke. Because when it comes to stroke, one fact remains true: time is brain. The faster treatment begins, the more brain tissue can be saved.